Let's talk about phimosis and circumcision today. Phimosis, in simple word, basically is inability to retract the foreskin over the glans properly. This might be congenital, that it's present since birth, or this may happen in adult life due to various causes like diabetes or infection. But the thing is, unless it causes a major problem, like the hole becomes so small that it is difficult in passing urine, or there is bleeding in rare cases, patients tend to ignore it. This may be due to hesitancy, or they are feeling shame in discussing it with their family members or parents, and they avoid taking medical consult for same. So what happens is, over time this causes various complications, like there is difficulty in maintaining the hygiene because you are not able to retract the foreskin properly and clean the glans area properly, or it can cause infections both in the glans area and urinary infections. And later in life, there is difficulty and pain during the sexual intercourse. In fact, most of the young patients come to me immediately after their marriages when they start facing such problems. Now, once the diagnosis has been properly established that there is phimosis, the definitive treatment for this is a surgical excision of the foreskin, in which the foreskin is completely removed and glans becomes free. Now, there are various methods by which this can be done. First is the conventional surgery, in which we give local anesthesia, anesthetize that part, and we use a blade or electrocautery to divide the foreskin, and then the cut edges, they are stitched back together using a suture. Instead of electrocautery, razor can be used to divide the foreskin, and again edges are stitched back together with a suture only. And the latest surgical device which is there is stapler, in which we use a stapling device to divide the foreskin and join back the edges using metallic staples. So the advantage is, because the entire steps of cutting and joining back together, they are done by a machine, so it's much quicker, and also recovery is faster, causes less pain and bleeding. Another advantage of stapler circumcision is that there is a silicone ring over which the staples are fired. So over time, when the edges join back and they are healed completely, that ring comes off on its own, including the staples. So there is no need to separately go and get the staples removed. So if you think that you are suffering from phimosis, it's better to consult your doctor and get proper treatment. Thank you.